I'm Laurie Sehn. I'm a medical oncologist from BC Cancer in Vancouver, and I'm here at the ASH meeting. At this meeting, I presented updated data from British Columbia on limited stage diffuse large B-cell lymphoma. I think currently there's a lot of controversy on how to best treat limited stage diffuse large B-cell lymphoma, where historically patients were often treated with combined modality treatments, so 3 cycles of chemotherapy and radiation therapy. However, there's a big motivation to try and decrease the use of radiation therapy because we know it can lead to long-term consequences and toxicity. So since 2005 in British Columbia, we've actually been using a PET-based algorithm where patients with limited stage diffuse large B-cell lymphoma, and that by definition is stage 1 or 2, patients with non-bulky disease, so disease less than 10 centimeters and no B symptoms, and who would be radiation encompassable. Basically, patients receive 3 cycles of R-CHOP and then undergo a PET scan. The PET scan results then determines how they finish therapy. If they're considered PET scan negative, they would finish up with just 1 final cycle of R-CHOP, so an abbreviated course of just 4 cycles in total, versus diverting over to involved site radiation therapy. The PET scan generally is interpreted based on the mediastinal uptake, so it would be a Deauville score of 3 to 5 being considered PET positive. So we presented our updated results of this algorithm. We've now treated over 310 patients who have gone down that route and completed the PET scan. Of those patients, 80% of them are PET negative and able to finish up treatment with chemotherapy alone. The remaining approximately 20% are PET positive, and the majority of them have finished treatment with radiation. Looking at outcomes, we're quite struck by how remarkably favorable the outcomes are in the PET negative patients. So of the patients who are PET negative, the 5-year time to progression or progression-free survival is in the range of 90%. So the majority of these patients do very, very well with just chemotherapy alone. Of the PET positive patients, outcome is somewhat influenced by their clinical factors, but the relapse rate is approximately 20% in that cohort. So I think that we're still in the process of trying to look at biologic correlates and clinical factors to look more closely at who is relapsing in the PET positive group, so we can see whether or not other treatment might be recommended for those patients. But currently, in general, the entire group has a favorable outcome, but most favorable are the PET negative patients, which make up the majority and are able to get away with just a short course of chemotherapy.